Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and today we'll be visiting with some folks with Care, which is probably one of the big name carriers in the state of Texas that you need, particularly in the northern part of the state. A grand opportunity for a program that has tangible assets across the board when it comes to providers and benefits, but also in the support that is lent to the agents. Today's presentation is being recorded, and that recording will be sent to everyone who RSVP'd to today's meeting, but also it will be posted on our website at premiersmi.com and on our YouTube channel as well. You'll notice in the software that there is a portion for both questions and chat. We ask that you put your questions in the question box, and we'll make certain that we address them at periodic breaks within the presentation. Normally they're covered through the course of the presentation, so watch for that as well. We'll start with a bit of level set about Premier Marketing in the event that you're not familiar with us. We are a national marketing organization founded in 1968. We're part of the Integrity Marketing Platform with offices across the country, and we act as an insurance wholesaler working through independent insurance agents and agencies such as yourself, offering contracts at the highest possible commission levels with recruiting contracts available to those who qualify. We do what we do through a full portfolio of products aimed at the senior market. And that includes the basic Medicare programs, the Medicare Advantage and Medicare Supplement plans, and the standalone prescription drug plans, the PDP programs. But we also have a full portfolio of life insurance and annuity products, final expense life insurance, pre-need plans, long and short-term care programs, disability income plans, and the ancillary benefits that serve multiple purposes. And they include, of course, the dental, vision, hearing programs, critical illness cancer plans, hospital indemnity programs, accident plans, and we even brought out a telehealth benefit a couple of months ago, MD Live. That Medicare Advantage portfolio includes the national carriers and the strong regionals that can make a difference for you in your market. And that same philosophy carries over into the standalone prescription drug programs. And these are normally part of the contract you have with an MA plan anyway. When we speak of Medicare supplement programs, we have a robust portfolio of plans there for you as well. And as with each of these categories, specific marketing support programs to help you be successful in that space. We feel it's very important for you to be able to address the needs of all Medicare beneficiaries, regardless of income. And a lot of times that's what's boiling down to some choices in their basic programs. When you look at ancillary products, you have each of those categories with the leaders, national leaders in those programs there for you, for your use. We find that many beneficiaries need additional assistance in these key areas, and it not only brings another revenue stream to our agencies, but it most importantly takes care of that need in these areas. Because when we look at the Medicare market, if you look at it by just people turning 65, it's a burgeoning market. You don't hear of anything but the aging of the baby boomers, the silver tsunami, one every 10 seconds, 10,000 plus a day. And that's true when you look at just the age. But keep in mind that some folks now are working past the age of 65. Some of that decision's been affected by the pandemic over the last 18 months or so. But these folks will eventually come on Medicare. It's just that it kind of changes the number when we look at the market based just on age. But that's more than made up for by the folks that are on Medicare because of disability, 15% of the population. And you look then at the entire Medicare beneficiaries, we're looking at folks that have some health challenges. 2/3 of them have 3+ chronic conditions, and they have some challenges with their income as well. So we want to make certain that we can help address these choices, particularly in the state of Texas, where we have over 2.5 million Medicare beneficiaries. Now, of course, we've got to look at the service areas for the programs involved, but we have a healthy representation with Care in select markets. So we want to make certain then that whatever choice a person makes, we're there to help them. Because let's face it, they don't even have to take the Part B. They can decline it if they wish. Most don't, thankfully. And some will self-insure from the medical portion, or they'll pick up a plan, a Part D program to help with the drug coverage. Some will take out the standardized, modernized Medicare supplements and add a prescription drug plan, or some will select the option that is like the phrase off American Pickers, bundling through Medicare Advantage or Part C programs, which is what we'll discuss today. And if you look at it, for the folks that are coming into Medicare, now this includes the T65s, the regular agents, and the folks that are selecting Medicare later, where they deferred it for one reason or another. We have a pretty even split of some of these folks. And we have the population that says original Medicare only. Keep in mind that could be dual beneficiaries, Medicare, Medicaid folks. It could be people with retirement plans. It could be people accessing benefits through the VA. And it can be that portion that have chosen to self-insure. So we want to make certain that we have the programs to address each of those needs and speak to them in a language they'll understand. Don't mean to speak down to anybody who's on Medicare. I'm getting close to it myself. It's just that all these acronyms, folks will look at some of these language things that are put out there, and we need some help sometimes in defining what they are too. So one of the things you'll see in the follow-up is a link to this acronym guide put out by CMS, the Medicare Learning Network. Very important for us because Kaiser Family Foundation tells us that the majority of people do not review or compare their coverages annually. And we know how that can cost the individual, particularly when we have the opportunity to go through and help the people that are particularly vulnerable. We can help the folks that have a challenge understanding the Medicare programs, and we can help those folks that aren't even using Medicare's official information that's out there on the web or on the guide that they get either physically or electronically, or if they wanted to play with an app on their phone, it's there too. Easy ways to get additional information, but we can see that this fairly up-to-date Medicare and You video was created in 2015. 6 years later, we have less than 1 million views, and you have somewhere around 60 million people on Medicare. So you can see where people are not accessing the information they need to make a decision. And so our duty as independent agents is to speak to people either in person or virtually, depending upon their preference, and make certain that we're able to deliver that information in that manner. Let's face it, the last year and a half, they've been trained to do so. The doctors have done it. The specialists have done it. The hospitals have done it. The dentists have done it. Hey, even the faith-based organizations have as well. So they're used to receiving information in that fashion. We want partners that can help us in that regard, but we also want to make certain that we're delivering that information, how our prospects prefer. And so we've asked our friends at Care to come on and visit with us about the Texas Medicare market that they serve and give us some details on why Care and how it's a good fit for folks. So we have two of their good people on with us today, Ms. Tana Kersten and Ms. Trish Cloud, and they are here to help us understand the ins and outs of Care. And so let's start. Ladies?
Great. Thank you, John, so much. I appreciate you all joining us today to learn a little bit about Care. As we walk through this, I'm just going to let John know when I'm ready to flip to the next slide. Like he mentioned, if you have questions, type them in the box, and we'll make sure we get all those addressed before we're done here today. So let's go ahead, John, and get started. Thank you. So who is Care? John kind of touched on it a little bit for you guys. We were created by a group of local doctors back in 2009. We proudly serve over 15,000 members in the Dallas-Fort Worth area. And then 3 years ago, we were acquired by Southwestern Health Resources, which is our parent company. Next slide. So who is SWHR? So they're an innovative health network created by two very well-known and respected names, UT Southwestern Medical Center and Texas Health Resources. SWHR has more than 5,200 physicians in our area working together to develop new ways of improving quality of care for patients. Next slide. So for the counties that we actually serve, we are in the Dallas-Fort Worth area only currently. The counties that we operate in are Collin, Cook, Dallas, Denton, Erath, Hood, Johnson, Palo Pinto, Parker, Rockwall, Somerville, Tarrant, and Wise. And one of the things we always try to do for our agents is keep it simple. All products, all the extras we're going to talk about today are in all the counties we serve. So if you're out in Parker County, you don't need to figure out which care plan is going to work in that county. Next slide. So a little bit about our customer experience team. In the past, we used to have what we called a healthcare concierge model. We changed it in 2021 to be a customer experience team. So basically in the past, we had healthcare concierges that worked with our members. We had provider concierges that support our providers. And then we have our agent concierges that support you as agents. What we did for 2021 is we combined all those three areas into one group of folks and named it the customer experience team. So basically those folks are going to be your go-to for any issues that you have, anything the members have. Currently we're officed in Fort Worth, right across the Trinity River from the Fort Worth Zoo. We will be moving in August up to the Farmers Branch area, but all of our members do have the ability, not today because of the pandemic, but normally have the opportunity to come into our office, sit down, meet with someone. We very much from day one have always tried to give that hometown local feel to all of our members, and of course to you, your brokers. If as a broker, if you need help with something, you're not calling another state, you're calling local folks here that can support you. Next slide, please. So these are our plan offerings for 2021. We currently offer 4 PPO plans and 1 HMO plan option. There's a Care Choice premium plan at $200 a month. No, that's not a typo, and I will explain to you what that plan is. We have a Care Choice Plus at $55 a month, a Care Choice $0 a month, which has always been from day one kind of our flagship PPO product. In many instances, that plan is competitive to some of the other carriers in our market, their HMO plans. And then we have a Care Choice MA only plan that's $0 per month. The big thing about that MA only plan at $0 per month is it does not have a Part B buyback, but what it does have is extremely rich benefits. So if you have VA folks, TRICARE for Life folks, it does coordinate with that. So great option there that you may want to look at. And then we offer one HMO plan at $0 per month. So before we flip, John, to the next slide, or that's fine, you can leave it there. I just want to touch a little bit on this $200 a month plan. So all of these are Medicare Advantage plans. So this was created 2 years ago to be kind of a hybrid between a MedSup plan and a Medicare Advantage plan. For this $200 a month, what this does for you is if the member is able to stay in network, everything is zero, including Part B drugs. So if you have folks on chemo, radiation, some of those high dollar things that would fall under that Part B, they are all zero as long as they stay in network. So this is a PPO plan, so there is out of network coverage, but I would just, kind of make sure that when you're sitting with a prospect and determining if this may be a good fit, please make sure that you're checking all their doctors, all their specialists before you put them on this high premium plan to make sure it really is going to be a good fit for them. The other instance may be if they're on a MedSup and maybe they've got some underlying health issues where they cannot switch to another MedSup plan because of underwriting. There is no underwriting because we're a Medicare Advantage plan. So if the doctors make sense, it may be a good option for them, or maybe because of their age, maybe they're paying more than $200 or $300 a month on their current MedSup plan, and they're already seeing our doctors that are in network. Might be a good fit for them as well on this plan. So not going to be a good fit for everybody, but there definitely may be some opportunity where this might be a good fit for some of those folks. With that same $200 a month, you also get the included formulary that's exceptionally good that we're going to talk about that shortly. You also get your dental, vision, hearing, silver sneakers, and over-the-counter benefit all included for that same $200 a month. So it's nothing they're going to have to add on additional to get those benefits. All right, next slide, John, please. Okay, some of the things that set us apart from some of our competition out there, zero premium options with the PPO and HMO. Huge thing here, still no deductibles on Part D drugs. We've never had deductibles since day one. I've been with Care since 2011. We've never had deductibles. I will tell you that going into 2022, we still will be offering no deductibles on our Part D drugs. No preferred pharmacies, and we also have a nationwide pharmacy of 26,000 pharmacies nationwide. So if one of the things you're talking to MedSup people that they think, you know what, I'm leaning towards a MedSup because I travel, I'm spending time away from home, still may be a great option when they're looking at pharmacies across the country. A 90-day supply on all drugs for 2 months copay, $0 copay on all of our tier 1 drugs on the HMO and choice premium plans, $0 PC copay on HMO and MA only plan, and then $0 labs, x-rays, and diagnostic tests on that HMO plan. Okay, next slide, please. So new for 2021, some of you may have noticed CMS removed some of the restrictions on having benefits that target a unique population of people. What we chose to add for 2021 was the insulin senior saver benefit. So basically with this program, if you have someone that's using one of the select insulins, and I'm going to show you what that list is, it would be $35 for a 1 month supply or $70 for a 3 month supply. So even on these insulins, you're still going to get that 3 month supply for 2 copays. The other thing with these is there's also gap coverage. So once they hit the coverage gap, and normally they will if they're taking insulin, it's still going to be that same cost during the coverage gap instead of paying that higher cost every month. Next slide, please. We're not going to spend much time on this. I'll also give this slide deck to John, so he'll have it if anyone requests it. I'll send a PDF over to him. These are the items that are going to be included, and there's 3 slides here of the insulins that are going to be covered. The one right off the top of my head that's not included is Humalog. There's a generic for that, but some of these others are some great options, the flexible pens, different things. All these are going to be included in that Senior Saver program. Go ahead, next slide, please. And go ahead and go one more time. And one more. So the other thing we offer, and we've offered this for years, is gap coverage on our COPD or asthma inhalers. Just like insulin, these are super expensive. So people normally are going to hit the gap usually around August, September timeframe. It seems like the prices are getting a little cheaper this year than they were previously, but normally they still are at some point during the year going to hit that coverage gap. So on these instances, they have that gap coverage as well. So when they do hit the gap, instead of paying those higher $200, $300, $400 a month that they would normally pay, they would still continue to pay whatever the tier copay is allotted, that are assigned for that benefit or that prescription. So if you see here, like on the top, the Advair Discus, Air Duo, those fall on a tier 2 on our formulary. So whatever the 2 tier is based on whatever plan they're enrolled in is what they're actually going to pay through that coverage gap. And these also, you still get that 3 months for 2 copays. So huge savings there. And once again, as a reminder, no deductibles at all. Next slide, please. So let's talk about some of the included things that come with all of our plans. We have the preventive dental that's included in every plan. We use DentaQuest as the vendor for that. So no cost for all the preventive on every plan, and fluoride treatments are covered in that. It is a contracted network. HMO members, if you enroll someone in the HMO plan, must stay in network. And then PPO members can go out of network, but normally will have to pay up front and then get reimbursed. And normally that's going to be at a higher cost. Next slide, please. And then in addition, we also offer a dental rider, a buy-up that we can add on to any plan that you sell. Currently, it's a $20 monthly premium. $3,000 annual benefit maximum. That truly is the annual benefit maximum. Nothing that happens on preventive eats into that $3,000. Implants are covered. There is no deductibles, predictable copays, not a reimbursement if they stay in network on that, and no waiting periods. This is huge. Most carriers for their dental, for like things like root canals, crowns, those kind of thing, most of them have a 6-month waiting period. We have no waiting periods on our comprehensive services. So for this dental rider, you can add it at the time you enroll someone in Care and up to 30 days following their effective date. The caveat to that is during OEP, if you enroll someone during AEP for a January 1st effective date, they would actually have all through OEP or March 31st in which to add on that dental rider. Just know they can cancel at any time throughout the year. If they do cancel, they will not be eligible to enroll back in it until AEP, or if they have another special election, then they can add it back on again. Next slide, please. For vision, we use iMed, huge network. My husband works for Lockheed. We've had iMed for years, great option for finding a provider in network. HMO members must stay in network. PPO members have in and out of coverage, or sorry, out of network coverage. Out of network provider may require upfront payment, and then you'd have to be reimbursed. The routine eye exam does include refraction at no additional cost, where many of the others, it's usually around a $55 refraction cost. Ours is included at no additional. The thing to remember about this for iMed is Walmart, Costco, and Sam's are not in network. But like I live in Haslett, my mom and pop eye place that I see is in network. So there's still going to be your LensCraft or Sears, all those are all in network for them. So just if you can remember, Walmart, Costco, and Sam's are the ones that I know specifically are not going to be in network. And on the eye, you please make sure that you encourage people to stay in network because there is such a large network. What will happen if they go out of network is, for instance, on their glassware allowance on the HMO plan, we offer $150 glassware allowance every year. If they go out of network, that drops to $75. So that's where they're going to see the difference in network versus out of network. So you always want to try to encourage folks to stay in network anytime you possibly can on any benefit, really. Next slide, please. Hearing health, that's included on every plan we offer. That's by True Hearing, high-end hearing aids, multiple settings, including Bluetooth capabilities. The member would contact True Hearing directly. They would schedule a hearing exam with an audiologist. If they determined they wanted a hearing aid, they would actually order it, have that shipped back to the audiologist office. The member would go back in, they would help them with the settings, the fitting. It's very high-level concierge type service where they would not just ship the hearing aid in a box to the member and they'd have to figure out how to do it themselves. With the initial order, 48 batteries are included, and then they also do offer that 45-day trial period to make sure that is working appropriately for the member. Next slide, please. Silver sneakers, not going to spend much time on that. I'm sure you guys are all familiar with them. The one thing I will note is that they can go to multiple gyms. They're not limited. So if they're doing a curves on Monday, they can do 24-hour fitness on Tuesday and the YMCA on Wednesday. So no limitations there on that. Next slide, please. The over-the-counter benefit we have, I know it's not as robust as some of the others out there. This is our second year we're offering this benefit. It is $30 allowance every quarter. It is through a product catalog, use it or lose it. Orders can be placed online or by phone. The good thing about this is the company that we use at Medline is out of Wilmer, Texas, just south of Dallas. So when they do place an order, the average delivery time is less than 2 days. So when they do order it, they get it very quickly. And there's a robust amount of different kind of products. It's not just your vitamins, Band-Aids, those kind of things. Everything in there is under that $30. And they have things like blood pressure cuffs, slip mats, grab bars, things that are really helpful for seniors. And then when someone enrolls in Care and Care, they automatically will be shipped the product catalog, or they can also find it on our website as well. Next slide, please. So one of the things I think Care and Care has always been very good at, and agents that have been selling Care and Care for years, I think would pretty much agree. We are very good about supporting our agents. If we have agents that are doing events out in the community, they need goodies to give away, whatever it is, maybe they want to create some flyers that they can use and promote the event. We're always willing to help do some of those things. I have Kelly Blackwelder, my community engagement manager. She has relationships throughout the Metroplex where we plug in agents to do monthly activities with her. And then on the flip side, if you guys already have community activities that you're doing and you just want support to do some of those, then please reach out to Trish and myself, and we're more than happy to help do whatever we can to support you. Next slide, please. And this is just some pictures of some of the different things, some of the venues I've done. I've done a lot of dancing in the last few years. This here, the table, the Care and Care, that's one of our agents in our Care and Care polos. We're more than happy if you're doing events to provide you with Care and Care polos. So if there's anything at all that we can do to help you be successful out in the community, then feel free to reach out and let us know. Next slide. So one of the things that Care and Care is known for, besides the no deductible, we have pretty good benefits compared to everybody else. Some of our benefits are amazing compared to some of the others that you'll see once you really start looking at some of the comparisons of cost. But I think the thing that's always set Care and Care apart is our formulary. We have Dr. Shane Green that actively looks every year at all the competition out there when we're pricing out our drugs and our tiering. And I think there's some things that factor in this savings. And I'm going to show you a couple screenshots that we did, Trish and I, from Medicare.gov, looking specifically at insulin and COPD. So to kind of give you an idea of where that cost savings can come from. Next slide, please. So what we did originally on this first one is we included some, I deleted the portion on the left. I think this is going to be the COPD inhalers. Give me one sec here. So those are going to be compared to all the other carriers. So once we added those in, we also took 4 or 5 regular drugs that our Care and Care members are using regularly. We put those in Medicare.gov and then plugged in some COPD inhalers. And then this is how it comes out. We used our zip code in Fort Worth. So the cheapest option was the HMO at $565. And then the next cheapest was our Care and Care Choice PPO plan at $800. That's going to be that $0 PPO plan. Next slide. And then the next option is going to be the Care and Care Choice Plus PPO plan. That's that $55 a month plan. That jumps up to $1,286. And then the next closest HMO plan is Humana at $1,400 compared to our HMO at $500. Huge cost savings. So where you're seeing some of this factor in is, one, that there's gap coverage. 2, there's no deductibles on anything, and you get that 3 months for 2 copays. So you factor all those 3 things in, and that's where you're seeing some of these substantial savings on this. Next slide, John, please. So on these, it's the same thing. We did the insulins on these. We removed the COPD inhalers, still kept the common medications that our members are taking. HMO, once again, comes up as the cheapest option at $786. That $0 PPO plan is $872. Next slide, please. Then it becomes the Humana PPO plan at $1,544, but you see there's also a $295 drug deductible on that. Then it goes to the Humana Gold Plus HMO plan at $2,393. And then you get to United Healthcare at $2,400. That's $2,400, their HMO, compared to Care and Care HMO at $700. That's a $1,700 a year savings that you can save these folks on some of their medications. So if there's nothing else you take away from me rambling today, this is the one thing you have to remember about Care that's going to set us apart. Even if they're not taking insulins or COPD inhalers, you still need to definitely look at Care if they're using a lot of medications or medications that are showing up on some higher tier levels. Some of those medications that are tier 4s on some of the competition are tier 2 or maybe tier 3 on Care. So I met a woman last year at a senior center. I was promoting a dance for an agent, and she came in and said, "Oh my God, I'm so happy that Care is here." And I said, "Oh, you a member of Care?" And she said, "Yes, I just enrolled in January." And this was in February before the COVID pandemic hit. I said, "Well, welcome to Care. We're happy to have you." She said, "I will save $1,200 this year on one medication that I'm taking when I was previously on United." And that was nothing that's a inhaler, that wasn't a COPD, that was on one regular medication, but we saved her that much money on a year. So just remember that, that's probably one of the things that's my favorite thing about Care and why you would sell us. Next slide, please. So the other thing that we offer, and we've only actually been having an agent portal probably for the last year. We've done a lot of things on this. We still got one more thing we're testing right now to make sure it's ready to go live. Next screen, please. So you would access the agent portal at agent.cnchealthplan.com. And then you would just go log in, and I'm going to show you that there's also a bunch of information if you just want to go there without being a certified agent for Care and look at some of the information we offer. Some of our plan materials, our benefits are out there. So feel free, even without logging in, to go out there and take a look around and see what we got out there. But for you, once you're certified, you would just click on login. Go ahead, John. And then this is just going to kind of walk you through the process. Everything you do for Care, we don't have party IDs or unique writing codes. Everything is based on NPN number. So your very first time, you would just put in your NPN number and then click on reset password. Go ahead, John. And then it would ask you to enter your NPN number again, and then it would send that email link like you get with everybody else to click on there to reset your link. Once you click on that, it will take you to the following email address. You would click on the blue URL there. Once you do that, it would take you to the next screen where you would just enter your, it will auto create this crazy looking password that looks like a Medicare number. You can either choose to keep that and just click on reset password, and it will give you the option to save that, or you can go in and create your own, and it will tell you that what the requirements are if you want to create your own password for that. Next, please. So then the one last time, if you save it, you would just enter your NPN number and click login, and that will bring you to the actual home page where now you're logged in. You see at the top, you've got all the different tabs along there: commissions, application status, DocuSign, members, agent URL, store, which is what we're working on this week. And then you'll notice you're logged in. Up in the corner is me, Howdy, Tana, Kersten. So that's how you know you're actually logged in into the portal. Next screen, please. So on the commissions tab, you see here it pulls up member ID, last name, first name, enroll date, coverage period, pay type, comp type. So pay type would be payment, hopefully not chargeback. Comp type, there's going to be different options. It's either a like sale, initial sale where you got the big bucks, a renewal payment, or if you were originally paid as a like sale instead of your new sale, then you would see a true up amount. And it would list every sale that you're getting paid for that month, and then with the commission amount out to the right hand side, and then at the very bottom it would have a total which would match what your direct deposit was for. Next screen, please. Application status. This is where you would go online if you want to make sure your application, everything was good with it. I will tell you that on this, whenever you do a web app, then it usually takes 3 or 4 days where it will actually pop up in here. So don't panic. Once you do a web app and it's the easiest one out there, then you would go ahead and at the end of that, it will give you a confirmation number. Once you do it, it automatically feeds into our enrollment system. And then it comes back to Care on what's called an eligibility file. And that is what will populate this screen. So that's why there's like a 3 or 4 day delay on this. Next screen, please. Due to COVID last year in March, we added a DocuSign feature that we've never had before. So on this particular thing, all this is going to show you is every application that you've submitted via DocuSign. It's not going to be a comprehensive list of every application you submitted. So if I'm with John today and I enroll him in the plan, that would not show up here. The only ones that's going to show up are going to be ones that you physically enrolled someone and sent them DocuSign the application to sign. Next screen, please. On the members, this is going to be a true list of all the members that you enrolled in Care. The cool thing about this is that column on the far right, the birth month, you actually would have the option to click on whatever month. So for instance, if I wanted to click on July, then I would see a list of all of my members that I've enrolled in Care that have a birth month in July. That way, if I want to call them, send them an e-card, send them a birthday card, it's quick access for you to get the list and all their demographic information for that. Next screen, please. For the agent invitation URL, this is one of the things we added just about probably 6 weeks ago, something I've been wanting to do for a long time. So this will actually give you the ability that you can click on a link that says copy URL, and then you can paste it in an email or put it on your Facebook page or whatever. And once you send that, anyone who uses that, it would be a regular web enrollment, but it would be having you tied as the agent. So every agent that has this agent portal that they log into their unique portal has their own specific URL that is tied to them as the agent. So very cool feature. Easy if you're on the phone with someone, they don't want you to enroll them, they want to enroll themselves. Great, I'll email you the link. You can enroll it. They don't need your NPN number. This is the same web app that if someone went to our Care website and enrolled themselves without an agent, it looks exactly the same to them. So super easy, but it still ties you as the agent of record. Next screen, please. And that's just what it looks like. Agent invitation URL. Once you click copy URL, you see the link above there. That's the actual link, and then it would see your name in there. And that's how you know it's tying you as the agent of sale. Next screen, please. Store, that's going to be coming soon. That's what we're finalizing hopefully this week before we go live. That's going to give you as the agents the ability to go in and customize your own flyers. If you want to purchase things, you can generate things and create a PDF where you can download. Maybe you have a printer that you want to use yourself, or if you want them to go ahead and print it for you, then you'll have the ability to pay for it right there as well. So hopefully that'll be up very soon. Next screen, please. So on the DocuSign, this is kind of, I just wanted to share with you a couple of the emails. So from the agent perspective, this is what you're going to see if you do a web app and then you click it, you have determined that you're going to do it via DocuSign, so you're not with the beneficiary. Once you send it to them, you will get a notification on your email that says that it's been sent and that they viewed it. Next screen, please. Once they actually sign the document, you'll get an email again that says view completed document. So this is awesome. This will give you the ability to open it and then save for your records a signed copy of the application. In that web app, it also gives you ability to do the scope. So at the very beginning of the web app, it will say, are you with the beneficiary or are you enrolling them in DocuSign? You pick one of the two bullets. The next screen will be, do you currently have a scope on file or are you filling out a scope now? Either option that you pick, that scope will also be included in as a copy for your records that are included in this application. Okay, next slide, please. On the beneficiary side, this is what they're going to get. They're going to get an email saying review document. Nothing scary. They don't have to enter a Medicare number or nothing like that. Nothing that's going to scare the beneficiary. They click on review document. This is truly the same DocuSign that I'm sure a lot of you guys have used before to sign documents for yourself. Once you click on that, it pops up, has a yellow box, click start, takes you to the signature. They can sign with an iPad, a mouse, whatever they want. Click adopt and finish, and done. Next slide, please. And then they also will get an email immediately, just like you guys do, view completed document, where they can save a copy of everything that's signed for their records as well. Next slide, please. So without logging in, I mentioned that if you guys just want to go take a look around without logging in, these are the things that you can still see out there. On the very home page, there's resources, interested in selling Care, agent online enrollment form links. That is where you're going to find your web app when you enroll, folks, right there. So you don't even have to log into the portal to get that link. And if you want to get the link and then copy it to your desktop or whatever for easier access in the future, absolutely you can do that. Next screen, please. So under the resources tab, you're going to find sales and marketing material, agent forms, policies and procedures. And then you see here on the right-hand side, your Care team, news and alerts, agent portal help guide, any assistance, which would take you back to agent support. And then once again, that agent enrollment link. Next slide, please. So here's going to be a list of all of our sales materials that we have, the benefit highlight brochure, English and Spanish. We currently do not have anything printed in Spanish, but if you need something in Spanish, this is the PDFs of everything we have out there if you need them. The benefit highlight sheets, these are useful if you're doing maybe a Care sales presentation and you're only having to present one particular product. Maybe you want to talk about the HMO plan. It's just a one-page sheet to use to cover benefit information. And then every plan that we offer, as you see, has their own highlight sheet. Dental health supplemental benefit procedure code guide. And then we have one as well for included dental benefit. So both of those are going to give you the codes where dentists would use for billing and what the copays would be in network for each of those. The next thing, a drug list, enrollment forms, the HMO and the PPO are enrollment guidebooks that once you're certified, you get sent those automatically. The Medicare Aware Guide, the Medicare question answered sales presentation, that's what you would use if you're doing Medicare 101s or Care sales presentations. You would use that plus one of those items above for benefit information. And then over-the-counter catalog, if you want to take a look at what items are included in that catalog I talked about. And then scope of sales, which you're not going to have to use because we already have it built into our web app. Next slide, please. Forms, transfer release form, assignment of commissions. Maybe you have an agency that you want paid your commissions to your EIN number instead of your personal social security number, direct deposit form, and then W-9. When you do your certification, which is super easy, we're getting ready to go live hopefully this week with 2022, and we'll get all that information over to John for you guys. The direct deposit form and W-9 is included in that. So you don't have to go out and fill these out separately. Next slide, please. And that's it. So that's all I have. Do we have any kind of questions or anything that I need to answer for anybody?
It appears, Tana, that you have been very thorough in your presentation. We do not have any questions. I will ask one, however. The personal URL, that Pearl, is that
Yes.
Permissible to have that used in social media, on an agent's website, everything else that most people would look at it and see that's how I'm going to really pull some of the value?
Yeah, so normally you can. What we do ask, if you have a Facebook page or a website or something you want to use it, we would just ask you to reach out to us so we can just run it by compliance, make sure there's nothing on the Facebook or website, make sure compliance is good with everything, and then absolutely you can use that.
That's awesome. That's standard operating procedure in the world of our litigious society. So that's the way it
Exactly.
works. So awesome. I thank you for your presentation. We're
Of
going to run
course.
through just a few more slides to speak to how uh, associating yourself with Care through Premier Marketing can be of value to you. Some of the things that we offer standardly as a repository for your agent information that allows you to contract compliantly, quickly, electronically for products as well. We'll do some specific things for Care direct pieces, but this is a nice place to store your E&O, answer a bunch of questions, and do some things electronically for many products. We do offer discounted errors and admissions for qualified agents. What's a qualified agent? Well, you got a contract with us. So this is different than being added to a blanket E&O policy for just one program, and you have to wonder, what am I going to do for the rest? You own this. You can use it to satisfy the requirements that insurance companies have, regardless of whom you're contracting through. So you own this program. We also offer discounted continuing education programs to keep your license in play through our affiliation with WebCE. And you have an opportunity to pick up disability income programs for yourself on a modified guarantee issue basis on which you're paid a commission on yourself. So a great way to add to your personal benefit package as an independent broker. Much as where today's presentation is being recorded, we have a number of past presentations that can be very helpful for you. They are accessible, as I mentioned at the beginning of today's presentation, on our website at premiersmi.com, but also on our YouTube channel as well. They include carrier information and a bunch of marketing information that can help you in your pursuit of gaining additional clients and building your book of business. We do also offer complimentary to our contracted agents Medicare Center. And this is a program that has 3 quoting engines within it that are accessible through one universal logon. It has a CRM included in there to help you manage and track your book of business, be it folks that you've enrolled or that you haven't. And it is also a tool to get the compliance requirements satisfied, where you can get the scope of appointment by text and by email, a number of different ways that are in it. It also has within it a resource center that gives you a lot of information on different programs and other things that can be helpful for you. And we're happy to say that Care is available through one of these quoting engines as well. So thank you, Tana and Trish, for fighting for that and getting that done. It is a great way for you to also offer quotes on cross-selling. And this is something that we'll send as part of today's follow-up, or as soon as the webinar updates in the systems, where you can go into a household, and even though the product for the base medical, you can't nudge them off the snide for it, it's still the best fit for them. It allows you to go in and perhaps add details on a hospital indemnity program to take care of those pieces, so you walk out of an appointment with a sale anyway. Many of the programs do offer incentives and trips. In the MA and PDP world, of course, that doesn't happen, but for Medicare supplements and other ancillary products, it does. And those programs, we have them on a specific place on our website. You can access all that information, and it can help you qualify for Premier incentive programs as well, which last year was going to be a trip, a cruise. We all know what happened last year, turned into a bunch of cash in a lot of agents' pockets. We do also help you get in front of folks. We offer contact lists, a call list that's custom ordered for you at a low or no cost, depending upon your contractual arrangements with us. It is a program, of course, that you can't cold call for MA or PDP, but you can for MidSup. And what we're seeing a lot of agents do, or an increasing number of agents do, is look at a 63.5 or a 64.5 and speak to them about dental coverage, because most of the dental programs have a price increase at the age of 65. So you're locking in a lower premium, and it gives you a way to add them to your book of business to do reviews on other programs down the road. We do also offer, and you might have noticed in the recording section, details on how to be successful in the retail marketing. A lot of talk about Walmart and some other carriers that are offering their own programs, but it also gives you some information on how to work with faith-based organizations the folks that actually deliver upon the benefits that we visit with, the providers, and that includes doctors, specialists, hospitals, but also dentists. And you notice in Tana's presentation where dentistry is a big thing and a nice benefit with an add-on benefit possible as well. Some carriers do supply generated prospects. We see that with some MA and PDP carriers. That's one of those you scratch my back, I'll scratch your type of situation where you have to have a good relationship with folks and work for it. We do also offer internet leads and direct mail support. And we have another piece that will come to you as part of the follow-up that speaks to maximizing your referrals on any lead that you get. That co-op program for the mailers is based on income, but it's a great way for you to qualify twice should you choose to do so with the proper production. So one for health programs, but also one for final expense programs. We do so through preferred lead vendors. We vet their information. We keep the correspondence that's going out compliant to make certain we protect you in that area as well. We do also have a couple of programs where you're basically buying the return and not generating the entire campaign. It is a program that these are leads that have never been touched. They're mail responses, but in this particular circumstance with the YIG leads, there's also a program for Medicare Advantage, all compliant and all at reasonable cost. And the costs do vary according to the area and what you're looking for. The Facebook leads are programs for final expense and Medicare as well. The Medicare leads are geared at a review and on Medicare supplements in order to satisfy different compliance programs. And there's no better way of asking for referrals, not only with the people that you're speaking with, but going back to your book of business and generating leads in that fashion. We say all this simply because, hey, we want your business. We want to be referable to you as well. So if you know of other agents that are looking for a home or looking for specific products that we've referenced, specifically Care, we'd like to work with them and we'd like your help in doing so. But we'd also like your contract. So all that said and done, if you work the North Texas market, we really feel that this is a program you have to have as part of your portfolio. It gives you the opportunity to add to your options, but also, as you can see through Tana's presentation, very strong benefits, an incredible network, and down-home marketing support from people who care about you selling their program. So as John Wayne said in the Cowboys, slap some bacon in that biscuit, saddle up, and let's ride because we're burning daylight. We got months to go before 2022 benefits, and this is a great opportunity because of all those steps that are out there to help people now and moving forward. So watch for the follow-up that we'll send to you. It will come from me, and it is an email, blind copy email. It will have the data that we've talked about, including a link to the recording. But remember, as I mentioned at the first of the presentation, that recording will be on our website at premiersmi.com and on our YouTube channel as well. So that said, I'd like to close out simply by thanking you. We appreciate the investment of your time that you spent with us here today. It's your most valuable resource. For those of you that have worked with us in the past and have a relationship, we thank you for that relationship and for the business. And for those that are about to, we thank you for that as well. Tana and Trish, any final comments?
Nope, absolutely. I think we're good, John. Thank you so much for having Trish and I and Care today with all you folks out there. We appreciate your time.
Well, thank you. Great presentation, very thorough. And folks are going to get a PDF of the presentation as well, because I know a lot of times sharing the information with an agent helps you understand it better, and it might make them referable as well. So all that said and done, until we have the option, the opportunity, the chance to speak with you very soon again, we wish you good selling. Thanks so very much, and we'll talk to you all soon.